Okay, so
Okay.
good afternoon, everyone. It's a very good day here in Abuja, and I've been joined live and direct um, by Dr. Funke Olofin, who happens to be an academician and at the same time a clinical psychologist, joining us on today's episode of the Smoking Cessation Support Program. I'm glad to have you all join us. Dr. Funke, you are welcome to this platform too.
Thank you very much, Pharmacist Qazeem, and good afternoon, all.
Okay, so we'll just take a little while waiting for people to join us. But of course, as we are joining, remember this is the third episode, or let me say the third module of the course, or the sessions that we've been having as regards building your capacity to be able to quit smoking or support someone that is willing to quit smoking cigarette. So beyond what a lot of people might think, this is not meant for just smokers alone, but it's also meant for people that are struggling to quit or people that have someone around them that is wanting to quit. So empowering yourself with some of this information will help you to support them better to be able to quit. Without having to waste time, this session is particularly based on 5A model for smoking cessation. So this is a well-researched area. People have used this same model to be able to help persons struggling to quit. And you would notice that there's a rider there that says empowering healthcare workers to help smokers quit. However, this is more like an holistic approach for even people, for even caregivers to be able to help others as well. So beyond you being an care worker, you could be a family member of someone that smokes and wanting to quit, and this will be very useful for you. So I'll say at the end of this particular session, you would be able to understand what the 5A model is. For a lot of us, it might be the first time we're coming across this. So be rest assured by the end of this video, you would have an idea of what it is and how to use them in motivating someone, in helping someone to quit smoking. And of course, at the end of the day, you'll be able to recommend behavioral and pharmacological support that is available to people wanting to quit. So in all of this, you would help them to be able to prevent relapse. Relapse meaning going back to smoking again, and support them for a long time in succeeding in their quit journey. So previous modules, we've talked about why it is even important for people to even quit smoking. You would agree with me that the health risk of continuous smoking is enough to want to make someone want to quit smoking. And I would say that one of those things that we dread the most about the smoking is the fact that it's a risk factor for lung cancer. A lot of people that died of lung cancer, over 90% of people that died of lung cancer would have been exposed to smoking at a time or the other. However, this could be active smoking when they do smoke themselves, or passive smoking where they live around people that smoke. So beyond wanting to quit for yourself or wanting someone around you to quit, you're not only helping them, but you're helping people around them to be safe from the risk of continuous smoking. Heart disease is also another area that we would need to also be very wary of. It could also be a risk factor for stroke and for lung disease such as COPD. So secondhand smokers have said children and non-smokers around us are at risk because some persons are smoking. So it's important that we continue to do this conversation, continue to push for people to want to quit. Of course, the benefit that is accruable to quitting smoking is also very important. It's suffice to say that within 20 minutes of quitting smoking, someone's blood pressure would drop. So that means that for someone that is already having a high blood pressure, once they quit smoking, in just 20 minutes, you start seeing the the results. And in 24 hours of smoking, the carbon monoxide that settles in the lungs of that person's, start going away from that area, and that helps them to be able to fight COPD that I mentioned, or even lung cancer as it may. And after 1 year, the heart disease risk, so meaning that someone dying from stroke could also reduce just after 1 year. Now, that is just like showing the significance of what we are doing. However, for today's session, we are going to be focusing on the 5A models. So these 5A models, I'll just let Dr. Olofin to take us through this model. However, I'll give us to take us through the model and bring our own insight as a clinical psychologist to this particular model. However, the five models is just about saying you ask, you advise, you assess, you assist, and arrange for follow-up when you are helping someone with smoking cessation support. Over to you, Dr. Funke Olofin.
Thank you very much, sir. Okay, before talking about the 5 E's, the model around the 5 E's, I would like to go back to what smoking is, or smoking addiction. And talking about smoking addiction, it is actually a complex interplay of psychological, physiological, and social factors. And it makes those people who are involved in smoking to eventually turn to addicts, because at its core, smoking addiction involves both physical dependence on nicotine and physiological reliance on the act of smoking. Okay, so talking about the 5 A's, which he actually said, he talked about acts, advise, assess, assist, and arrange. Around asking, it is important for clinicians, for healthcare workers, people who intend to prefer solution, to use this model to be able to get reasonable outcome. So around acts, it's good to identify the smokers and assess the type of smoking substance they actually use. It might be tobacco, it might be regular things that they just inhale. I read through a research and I saw that in certain countries, some people sniff bone, some people sniff sock away, some people sniff solvent. And talking about advice, it is strongly recommended that quitting smoking should be done in a personalized way, because we are all unique and different, and we are expected to also have different turnouts. So it is good that smoking program around advice need to be structured in a way that it will come out to be personalized. And talking about access, it is also good that you evaluate that person's readiness around quitting the act. It is also good that you identify barriers or things that motivates the person. It might be education, it might be school, it might be travel, it might be family, and that is why it should be structured as or structured to that individual's need. Then talking about assisting that individual, it is also good to develop a personalized quit plan, and strategize resources around it. This process looks like general. However, it is important that you structure it. You know your clients very well. You know the patient as good as one-on-one, so that you get good outcome. And arrangement, or arrange as it is on the slide, it is also good that you have structured schedule for follow-up. You cannot just help them and feel that a one-off session should be okay. After therapy, it's important that you follow up on them. It shows that you care. It shows that you are actually interested in the patient, in your client. This also serves as support or serves as a platform to monitor progress. This is because the occurrence of relapse is really high in such activity, because it also involves physiological, psychological, and social or environmental influences. So all of these play out around people getting hooked to such acts. Thank you, Mr. Qazeem.
Okay, thank you very much for that overview of the five A's. Digging deeper into the first A, they ask you are identifying tobacco users. Now, for us healthcare workers or for healthcare workers or even family members that are willing to go the extra mile in helping someone, you might want to ask whether someone takes tobacco. And it's important to know that smokers themselves will not mention to you that they smoke until you are able to probe beyond, just the surface level. So that makes it important for us to be able to get that information. So if you are a healthcare worker and you need to get all of these things, when you include such information in their medical history or in their social history, you will be helping, in the assessment and even in the recommendation of care. Apart from even the smoking cessation, you'll be helping them to get the best recommendation for how things should go. Now, if you really need to ask these questions, it's not a yes or no kind of question that you would have to ask. You would need to ask an open-ended question. So, if you say, "Do you smoke?" Um, yes, it will be a yes or no thing. But if you go beyond just saying, "Do you smoke?" or "Do you use any tobacco product?" Like she mentioned, that some persons might not smoke cigarettes. Some persons use e-cigarettes. Some people use electronic cigarettes. Some people do a lot of different forms. So you want to understand what that means. And I'll share with you that my first focus group discussion with some persons that are already with us right now trying to quit smoking, we're able to ask this question: what do you smoke exactly? What exactly do you smoke? And they will tell you they smoke everything. They smoke this, they smoke that, and that is something they do. So we ask again, how often do you smoke? Somebody mentioned, I could smoke one pack in 24 hours. I could smoke two packs in 24 hours. Some persons mentioned, oh, I do 20 sticks, I do this. Now, then have you tried quitting before? This was a question we asked. It will surprise you to know that a lot of them have attempted quitting severally. As a matter of fact, the group I met were mostly Muslims, and they mentioned to me that every time there's fasting, they attempt quitting. Every time there's fasting, they attempt quitting. So the question is, what motivates them to want to quit? That is something that we've asked severally, and we've gotten answers as regards that too. So the next A is to advise. Now that we've understood that they have attempted quitting and they are still interested in quitting, that means there's a barrier, there's a particular thing that is motivating them to continue to smoke. So, like she mentioned, personalized advice. Now, because we understand that somebody's case will be different from another person's case, we want to advise them differently. And we want to be very clear about what we are telling them. Now, this is about advice. Um, just like she mentioned before now, our kind of advice is not going to be you trying to force your own thinking around them, but helping them to nurture what they have started thinking of. They wanted to quit. They had challenges quitting. Then all we need to do is just to put in effort just to support them on that journey. And that is a mindset that anyone that is trying to help someone to quit must hold. You must hold the mindset of you are supporting them on that journey. You're not judgmental about it. You're not trying to make them feel less of themselves. You're only trying to support them to be able to achieve what they have to achieve. And because you will understand that The end result is what we are all looking at. So you will be coming from the emotional angle that, oh, what if you do this? This is what your health situation will be like. And that's why, that first slide that I showed, that after 20 minutes, this is what they gain. After, 24 hours, this is what they gain. After days, this is what they gain. And this is something that we can always do as health professionals or even clinicians. And as it is, like or even psychologists, like my sister here. So I'll go to the next, but I want to know if you have anything to add before I proceed.
Okay, I would actually like to add to the advice part. And talking about advice, I would also encourage that when that part of advice needs to be taken, it should be a strong recommendation from a trusted source, somebody who is considered to be highly valuable to that client, to the patient in quote. If it happens to be a random person, a person with little or no value, such advice might not be given strong consideration. And when advice is taking place, it should be non-judgmental, not being biased. It should be clear. It should also be personalized. I would still repeat that one. It should be clearly communicated. Things around the health risk, diseases around the heart, the lungs, even the teeth, the breath, even disengagement from social strata could also be part of it. Knowing that not everybody really wants to associate with one who is actually caught with such act, one who is hooked with such act. Thank you, Mr. Qazeem.
Okay, so just as she has mentioned, of course, we don't have to be judgmental. And there's something I forgot to mention: the fact that yeah, our instruction, our okay, let me say our advice should not be instruction kind of advice. It should be a very subtle way of telling someone. For instance, we must avoid a sentence like "you need to quit now." Instead, you should say, "I strongly recommend quitting and I can help." So that would help the person. Or personalized statements such as, since you have high blood pressure, quitting will lower your risk of heart attack. Things like this stays more with people rather than saying, oh, if you continue to smoke, you just have a heart attack and you die. I don't know if that makes sense to us. So we must ensure that the message you are passing across is not just a message that would make the person, feel like, oh, the end is here. Then I should just let me just end it. Then, if the end is here, then let me just end it. So we must do this every now and then whenever we are doing it. Now, assess readiness to quit. Now, this particular area means that someone that is already seeking help, that wants to quit, will be better supported than someone that is not have not made their mind whether to quit or not. So, how do you ask this? On a scale of 1 to 10, how ready are you to quit? Somebody will give you an answer on a scale of 1 to 10. How ready are you to quit? I can tell you that the people that I've come across, those that I mentioned, some of them have smoked for 20 years, some for 25 years, the people I'm talking about, and they tell you that on a scale of 1 to 10, brother, it is 9/10. That's what they will tell you. 9/10 for them. So meaning that they are ready to quit. The next thing is you should just move to assist them. Somebody will say, okay, maybe 4, 5. Yeah. So anybody that is within 4 and 5, you want to discuss the benefit and motivation with the person. So the level of readiness determines what action we need to take. So if somebody is still on 1 to 3, we might need to provide more education. You're not going to judge the person, but you are telling the person, okay, so people that smoke, this is how their life shortens because of cancer, or because of COPD, or because of hypertension, or because of heart attack and other heart diseases. So they live 10 years younger than every other person. So the person keeps thinking, so if I'm meant to live 60 years, that means by 50 I am gone. That's so the person would tend to understand us better rather than us looking at them like, oh, they are condemned already. They cannot be redeemed at that point in time. So I would say that readiness to quit is very key for us to be able to help them. But we must rate them to know what intervention we need to bring in at that point in time. Do you want to add something, Doctor?
Okay, so I actually have it as for access, I have it as assess objective, assessing reasons why people intend to quit. And questions like the following questions I'll put up can be asked. So questions like, are you thinking about quitting smoking? Asking that patient, are you thinking about quitting smoking soon? Or what are some reasons why you might want to quit smoking? What barriers do you see or do you experience in trying or when trying? Such type of questions can elicit reasonable response, and from this response you'll be able to deduce that this person actually has high intentions or average or has no intention. you know access objective is really important to the 5 stages and cannot be skipped. Thank you.
Okay, thank you very much. So the next is the stages of change model. Now, this on its own is another concept entirely. However, it shows that for every action, for every change that we want to make in life, all of us go through these particular stages. The first stage is pre-contemplation. Now, someone that the readiness to quit is around 1 to 3 is probably at the pre-contemplation stage. They are not thinking about it, they are not ready. So the signs you would see is that they are not ready. They will tell you on a scale of 1 to 10 is 1 to 3. That's most likely what they will tell you. And what you need for such a person is to educate the person on the risk and benefits of quitting, the risk of continually smoking, and the risk of quitting. Now, this particular concept is something that relates to every kind of habits that we have, not just habits, even all the changes that happens in human life goes through these 5 stages. This pre-contemplation stage, and then the next thing will be contemplation. Somebody is already thinking about it. Yeah, somebody that is around 5 has gone far beyond 1, 2, 3. So the person is thinking, okay, maybe I should give it a thought. Now, that person, you want to address the fears that the person is having, and you want to help the person build their motivation to quit. Now, this is very, very, very simple because a lot of time people are scared of what becomes of me. I shared an example in my previous video where a father is hiding his smoking habit from his son because one day they went out and then the son saw someone coming out of a bush and he was just he was smelling cigarettes, and the boy said, "Oh, daddy, that guy is a bad guy." And the dad asked the question, "Why is he a bad guy?" He said, "No, he just finished smoking cigarettes," not knowing that the father too is also a bad guy because he also smokes. So there's a fear that I don't want my son to catch me smoking. It motivates him not to smoke at home. But once he's out among his peers again, he want to go back to smoking again. Now the next stage is preparation. Yeah, someone like you mentioned, how soon do you want to quit? Someone that is saying, okay, I want to quit, but how soon? I'll quit soon. That means the person is already preparing their mind. However, if you remember in the last module too, I mentioned that we must set a specific date for quitting. If you're planning someone to quit, you set a date. Let the persons continue to have it in mind that yes, on the 3rd of March, I want to quit. They're having it in mind, so it prepares them ahead of time. So their mind and is also the body is preparing, the mind is also preparing at the same time for that date that have been set. So you help create a quit plan. You remember, So now the quit plan for this person must start at that point when the person said, I'll quit soon. How soon that? Should we choose a date? You choose a date. Okay, so how do you want to start? Do you want to do the cold turkey, which is not appropriate anyway, abrupt withdrawal? Yeah, okay, you should do gradual. You advise the person, and then before you know it, the person is already in. Now, the next stage is action. Somebody that has passed the stage of contemplation is preparing. The next thing we want to do is, yes, action. The person will quit. So that 3rd of March that have been proposed would come, and the person will say, I just quit. So at that point, there's high chances of person relapsing in the first few weeks of quitting. So you will be available to support the person. Coping strategies, you put all the coping strategies in front of the person. I mentioned in my past video that some persons would even do some local means to be able to cope. I mentioned to us on this channel that I'm aware that the neem tree can be used like a chewy stick to reduce the craving for smoking, which has worked for this particular group that I've been meeting. I think we've met for a while, and they are also on a WhatsApp platform with me. So this, you must continue to give them all the coping strategy. You must continue to do the delayed tactics. Tell them how they need to delay, and of course the non-nicotine replacement therapy that we mentioned, whether it is chewing gum, whether it's lozenges, whether it's patches, just to replace the craving for combustible nicotine that they have. Now, I mentioned that relapse is a very common thing. So the last phase is for you to protect the person from relapsing. I quit 6 months ago is will be one of the signs. You support this person to ensure that they don't go back to that habit. Now there are a lot of motivations for going back. We mentioned in the last video. Some people it could be stress, some people it could be anxiety, some people it's the life events generally that will just take them back, or some other person could be peer pressure. So we would have to protect them, ensure that they don't get back into where they were before. Encourage them every now and then to make them see that they are doing well as it is. And I think that's it on this slide. Dr. Olofin, do you want to add something here?
Okay, so thank you very much for sharing these important stages of change model. And I would add to it that these are important stages of change model towards addiction, not just addiction to smoking, but general issues around addiction. So this is not just for substance use. It could also be physical addiction, like smartphone, gadgets, and food. The list continues. However, these stages are really important for healthcare workers, for people who intend to provide services, to be aware of. Why is it so? This is because quitting smoking is actually considered hard, hard as in HARD, but it is possible. It is possible to achieve. It is possible to achieve, but considered hard. It is possible if you have reasonable hands, if you go to the professionals, if you seek professional help, but it could be difficult or hard because of the following reasons. Because of reason one, which I consider to be withdrawal symptoms, also known as withdrawal syndrome. It could also be difficult as a result of triggers and cues, the environment such smoker find him or herself. It is also difficult because of relapse, just the way you mentioned. Um, Based on my profession, I'm actually in a group, and I heard somebody talking about how he can manage relapse after going through putting in so much energy that he's actually heartbroken. It is part of the process. Relapse, we shouldn't pretend that it will not happen, but how many times that person falls, we need to count a step ahead of him standing up or her standing up again. And the last or very important thing to note on this list is social support. If there's if such individual, such person or patient has strong social support in the terms of family, friends, professionals, religious people, helping to say, yes, I know you might be going through this. I know it might not be good for you health wise, religious wise, society wise. I know you're also stuck on such habits, but I refuse to throw you away. I am there for you. Social support is
Exactly.
actually key. Thank you for sharing the stages of change model, Miss Pharmacist Kazim.
Okay, so while we are confirming the fact that stages that we just show is helping us, we must also assist in building, a quick plan. I mentioned that someone should say, okay, I'm quitting on 3rd of March. Yeah, you must set a date. You must identify triggers, just like she mentioned. And we must set aside coping strategies. She just talked about social support as one of the coping strategies. People would fall, people would want to quit or even relapse. But because we discussed it, withdrawal is also one of those things. Of course, we must also recommend, the other methods, particularly maybe pharmacological method that could help this person to quit smoking forever. Now, there's nicotine replacement therapy we mentioned. There are medications that can be prescribed for someone to be able to quit smoking, and of course, behavioral support. So, as a clinical psychologist, yeah, this is part of the things that she does. So, supporting someone, counseling someone, and I would say that by the time there's also chatbots that could help someone to quit, where you just relate with the chatbot, you talk with the chatbot like you're talking to human, and then they reply you, they give you guide, they counsel you, so they act like they are human, and then take you through that journey. And fortunately for us, they are non-judgmental like human. They do not have the human mindset. They are not even seeing you. They don't even know who they are chatting with. So you could be sure that the social stigma that comes with even seeing a counselor will be taken care of in this sense. So that's is something that we might also want to have at the end of the day. Of course, the follow-up, the arranged follow-up for to prevent relapse is also very important. It's been said that the first 1 week is the highest time that relapse occur. So people will struggle through the first 1 week of quitting, and then within 1 month again, they would have to be supported. So you will need to fix within 1 week. The first 1 week, you want to see them more frequently, and maybe after then, you can now make it 1 month's time. In 3 months, you want to see them again. In 6 months, you want to see them again. And of course, we'll have a channel that you can continuously support these persons to be able to, quit. Um, of course, when they do happen, relapse are inevitable. And when they do happen, we are not going to be judgmental. You cannot shame the person or even blame the person for relapsing. This is something that could happen to anyone. So it is being said that relapse is a normal part of quitting. So when it happens, you only tell the person, okay, can we adjust your plan? Encourage another quit attempt. So every time they relapse, you tell them, oh, don't worry, you can do it again. And then they are back to it again. So that continuous motivation keeps them in, ensure that they are able to do more. And that is the idea we are trying to push across. Each and every one of us knows someone somewhere that is trying to quit. But whenever they try to quit and maybe they are back to it again, we may sometimes shame them or tell them, no, you are not doing well and all of that. Part of what we want to take away from this session is that when you see someone that is struggling to quit, it's beyond their power to quit. That's why they relapse. But then if you support them, they will be able to quit better too. And that takes me to some real life case scenario that we have. So this particular first one is tagged social smoker. A lot of us know what social smokers are, right? they smoke only when there are events where they are in a particular gathering. They are not continuous smokers like that. So this smoker is named JD, and he's 22-year-old. He's a university student. He started smoking at 18. So he's been smoking for 4 years. And on a daily basis, JD does 10 cigarettes per day. He never attempted quitting. You agree with me that this person that has never attempted quitting probably do not even know the risk that is attached to continuous smoking. Probably he's still in that stage of not deciding yet, pre-contemplation stage that we're talking about, and he has no major health condition, but complains of occasional shortness of breath. Then I made this in bold because I want this to be our entry point to attending to JD. If you're going to be talking to JD, this might be our entry point. Now, for this particular JD, he has low motivation to quit smoking. He's not even thinking about it. Of course, because he's a social smoker, he's likely to be under peer pressure when he smokes. Maybe when he goes for a party and all of that, he gets to smoke, or when he's within a circle of friends, then he gets to smoke. So, and this person might likely be denying the harm due to smoking. So this might be one of the things that this person faces. So if you are going to have a discussion with this person, we don't have to be judgmental. Um, and you have to advise the person on a long-term risk of smoking. Of course, we might need to assess his motivation. As I'm looking at this slide, it's coming to my mind that all of these questions will be answered by Dr. Olofin. The first way, how would you, discuss with this person in a non-judgmental way? You don't want to judge him, but you want him to quit this habit of smoking. So we want to understand how should we undo this so that we don't become judgmental. And how would you advise him on a long-term risk of smoking at a young age like this? And of course, his readiness to quit, to want to attend to that, and to also understand how best we're able to support him to quit smoking. You might want to speak to one or two of them that resonate with you, Doctor.
Okay, which of them do you suggest I go with?
Okay, so how do we handle this person to quit without being judgmental?
Okay, so first of all, the truth is not how do we, meaning that such person with such issue should please try to go to professionals, seek
Okay.
professional help, seek trained experts. Don't go to people who are not trained. Yes, for qualified, licensed, or certified people, we actually give him what he's supposed to get. Okay, part of what the training entails is empathy, and looking at it from the perspective of empathy, such licensed person, especially around addiction cases or drug addiction to be specific, would know what to do, would not put it out there like asking questions to reflect judgment, would go around asking the question or would go around handling the issue in a way that shows so much empathy, like putting it to yourself, even as the professional. It could be you, it could be your child, it could be anybody, and it could also be the patient. So that helps to answer it. Please don't go to anybody, don't go to everybody. Not everybody can handle such issues, not everybody handles all issues. Go to professionals, go to licensed or certified healthcare workers to do this or to help out with this issue. Okay, so what other question do you
Okay,
want me
maybe
to
we should
attend to?
just let's just go to the next case. The next case is that of a long-time smoker with health issues already. The smoker is a female, AM, 55 years old, and a retired teacher. So this smoker smoked 20 cigarettes daily for 35 years. For 35 years already. And this smoker smokes 15 to 20 cigarettes per day. So on the average, 15 to 20 per day. They try to quit twice but relapse due to stress. And the health issue that is already in this person's condition is they cough frequently, they have shortness of breath, and they have high blood pressure. But for 35 years, this person has been smoking, and they really intend to quit smoking, but they are not able to because of strong nicotine dependence, after decades of use anyway, because they smoke when stressed or anxious. So whenever they are anxious, they are stressed, they get to smoking immediately. And of course, withdrawal symptoms will also comes into their life because they crave for it every now and then. And they gain weight whenever they stop smoking. So they feel like they want to smoke again. They feel they enjoy themselves being in that other way. And she feels too addicted to quit. So she doesn't think it is something that she should be able to let go of, or she will be able to let go of at any point in time. Now, this same conversation, this same kind of question would be something that we would need to attend to with this person. Of course, if we have to adopt the 5 A's to this person, just like you have mentioned, we must be empathetic and acknowledge our struggle. This particular person has struggled over time. Yes, she's been smoking for 35 years, but you would understand that she has struggled and she's not able to achieve success. So the kind of way we address this is, you've been smoking for a long time. What do you like about smoking? This is an open questions, non-judgmental. Yeah. Have you noticed any changes in your breathing or head energy level? This person will speak about something that is bothering them already, and then you have the opportunity to align it with their quitting plan. Say your high blood pressure puts you at risk of heart disease. Quitting will improve your health status. So when we talk about things like this, people will want to relate to it immediately, and they will struggle. Even if they will struggle, they would want to make an attempt again. It's never too late to quit, even at your age. Quitting will improve your breathing and overall health. And I'm sure if this was a conversation between myself and a smoker, the smoker would be more reasonable to want to listen to it. I can see you're responding, Dr. Olofin. You want to say something?
Oh well, when you started this second case study or case report about the lady, you talked about 30 cigarettes. You did not specify if it's 30 sticks or 30 pack. I really need to be clear on that. Is it 30 packs or 30 sticks?
No, no, no. She smokes 20 cigarettes daily for the last
Is it
35 years.
20 sticks or 20 packs?
Okay, 20 sticks. 26.
Okay. Okay.
Yeah.
I think is also an important one. Knowing that you're throwing it out there, you know. I would also add, or I would repeat after you, saying that of course it's never too late, yes, to quit certain habits. It is not too late to consider a change, and the obvious benefits in quitting, which you need to draw her attention to, knowing that she has been stalked over time. I think you'd also need to ask her reasons behind, because most importantly, during the course of therapy, it is important to know the cause, to know the root cause. You cannot just be treating or managing patients without knowing the reason behind, knowing the cause. That cause would equal to the effect behind her smoking. So, having known the cause, then you can now start your personalized therapeutic approach. So knowing the cause, knowing what has stopped for that long, and she doesn't see reason, or she finds it difficult to quit, is really important to the treatment plan or treatment package. Thank you.
Okay, as a matter of fact, the this particular the 5 A's is what we are using our case. So we are judging our case based on the 5 A's. We've done the ask, we've done the advice. Now we're talking about the assess now. If you ask this person on a scale of 1 to 10, how confident are you about quitting? If low, we want to discuss why she feels quitting is hard. So in that sense, we'll be able to, understand, the challenge that she's having. And of course, if it's high confident, we'll start a plan almost immediately. The next A is the assist plan. So if somebody like this is ready to take nicotine replacement therapy, we'll signpost where she could get them, and maybe support her to see a clinician that could even prescribe, medications that would help her too. And of course, because stress makes her to relapse back into this, we might want to signpost her to stress management techniques like deep breathing, like meditation, or even, bringing a psychologist to help her manage the stress effectively. And we cannot overemphasize the need for family support. So they encourage loved ones to be involved in our case would help her to be able to quit. And of course, the last will be to arrange a follow-up. Set a quit date within 2 weeks, set a follow for one week, like we said, 1 month, 3 months, 6 months, and of course, provide a WhatsApp group. Maybe add that to a WhatsApp group where she can be motivated if she's willing to do that, or get a particular phone line she could call for help anytime she's in need of that.
Can I add
So,
to that?
okay, go ahead.
It is also important that you link her to probably a group session or general tobacco anonymous group, where she would also be able to meet fellow people who are trying to quit, who are struggling, fellow patients who would be honest, who would be able to share their genuine struggles and how they've been, and process around how they have been trying to smoke. Such type of group has the group leader or the team leader as one who has successfully quitted the act of smoking. And for this kind of group, yes, such a client will not be like, okay, because you have not been there, you don't know what it entails. So, life cases of people who were actually able to pass this addiction process successfully would be shown to encourage others, or to encourage her, to motivate her that it is actually possible, and all her struggles are actually acknowledged and genuine. She is not just in it. There are other people who are also in it, and there are other people who have found a successful way out of it. This would also help with the 5A plan to put her on track to be able to recover fully from smoking addiction. Thank you, Mr.
Okay.
Qazeem.
Okay, thank you very much. It's so this is this takeaway from this session, and I want to just remind us the 5 A's model that we've talked about. The ask. So every patient would have to be asked these questions: whether they smoke, or how much they smoke, how frequent they do smoke, and that would help us to advise with clear and personalized message. And of course, we should be able to access the readiness of the client to quit, so that we can get the best support in place for them. And for those that are willing to quit, that are ready to quit, of course, a quit plan that works must be set, signpost them to medication, navigate them to counseling service, and of course, At the last A, arrange follow-up to reduce relapse. This is what we've discussed today, and I want to believe that each and every one of us that are joining live and those that will still watch this session have learned one or two things. And I'll just tell Dr. Olofin to say goodbye to our viewers from there, from my own end. Okay, thank you very much, everyone, for joining. We appreciate your time, and we hope that you subscribe to this channel so you would not miss subsequent sessions that we'll be having. Do have a great day, everyone. Bye bye.